and they're fast, and you get to learn about the organization, and you get to vote. How cool is that? We've been practicing really hard with this wonderful group here, and we're going to ask you to save your round of applause till the end, after all the fast pitches are done. We have 7 of them, and it's just going to be rapid fire. We're going to come up, and they're going to come up in this order. This is the order that they're in the agenda, as well as when we put up the poll right after the fast pitches are done, they'll be in this order as well. So you can just kind of remember that when you're voting. We want to do a People's Choice Award at the end of the conference. So polls will open right after fast pitch is done, and they will close right before our last plenary session, before actually the closing comments. And then Kristen will announce the winner. The winner gets a free ticket to next year's conference. So with that, I'm going to get off the stage, running back, and we'll get ready for John.
Hello, everyone. I'm John Browning, the CEO of Global Mentorship Initiative. GMI was created from the Rockefeller Foundation's Digital Jobs Initiative, and we work with students around the world who are nominated by their colleges, and we match them with a mentor just like you. And they complete a short-term online mentorship that's designed to help them get their first job. In just over 3 years, GMI has grown to over 5,000 students in 92 countries, and this includes 8 refugee camps in the Middle East and Africa. And we have over 4,500 mentors in 127 countries, including 1,000 Microsoft mentors. This is a highly structured program that's designed to make it easy to be a great mentor without a significant time commitment. And it's built to give our students a consistent, high-quality experience. They learn how to present themselves to the business world, how to speak with confidence, and they're building a business network of over 500 contacts during their mentorship to help them find their first job. They're learning how to set SMART goals for their careers, and they're learning how to think like a job recruiter. The most important metric, 74% have a job within 6 months of graduating college. And in the coming year, we'll have 5,000 new students, and the GMI program is built for scale much beyond that. Our sponsoring companies like the GMI model because it allows their employees to give back in a personal way, and it allows them to give back to their corporate mission of service. So GMI needs more mentors, we need more students, and we welcome financial support to help us extend this opportunity to underrepresented students around the world to help them get their first job. Thank you.
Hello, I'm Peter Kelly, the founder of Grow Further, and I'm going to introduce how we do international development. We aim to help smallholder farmers adapt to climate change and improve their income and nutrition, and we do that by putting out open-ended grant announcements seeking the best research and development projects from around the world. Then we select the ideas that have the best potential to reach scale because, well, why settle for less? Then we engage not only farmers, but also a diversity of donors and volunteers, kind of like an angel investment group. One of the projects we're funding is developing the first commercial variety of Bambara groundnut, which is an underutilized crop. This is a $133,000 project that aims to reach millions. But we're actually thinking bigger than that, like Rotary developed a polio vaccine, but also a sector of medical research charities. We're looking to inspire a sector of agricultural research charities for a food secure future. That's our long-term vision. There are lots of ways to get involved. Whoever you may be, we have a relevant and meaningful way to engage. So come and see our booth or contact me directly. I look forward to connecting with you. Thank you.
Hi, I'm Laura with Mona Foundation. Since 1999, we've partnered with grassroots organizations focused on education and girls' empowerment. From the outset, we have always believed that lasting social change must begin and be led by local communities. Over 24 years, we've partnered with 53 local organizations in 23 countries, learning to build true partnerships that unleash our collective power to build a better world. From decades in the field, we can attest this approach is effective, efficient, and transformative. Last year, Mona supported the education of nearly 1.7 million students for under $3 million. And we're now seeing exponential growth as our partners build capacity to scale their programs. For example, when our partnership with Study Hall I don't know what happened. Shall I just continue? When our partnership, for example, when our partnership with Study Hall Educational Foundation first began in 2008, they were refining a girls-centered curriculum at their school in Lucknow. By 2011, this had become a formal girls' education and empowerment program. The next year, Study Hall Education partnered with the Ministry of Education to bring this program into 12 state residential schools for low-income girls. More schools were added over time until this year, their program is now in every residential school in the state. That's 760 schools, reaching 74,000 girls. Chef also formed a coalition of NGOs last year and began teaching boys in co-ed schools to be advocates for gender justice. As for Mona's partnership in this story, Chef's founder said, "We would never have gotten here without your ongoing support and long-enduring love." After 24 years, Mona has learned much about building impactful, effective grassroots relationships, partnerships. I invite you to read our paper on Huva, which will be up here in any moment. And then let's connect. Let's connect and continue the conversation.
Hi, I'm Paul Essene, Head of Product and Innovation at Opportunity International. At Opportunity, our focus for the past 50 years has been on ending extreme poverty. We do that 3 ways: microbanking to help establish businesses, education to establish and run quality schools, and agriculture to help farmers grow more and earn more. Today, I'm here to tell you about Faustina. She's a smallholder farmer working about an acre of land in Malawi. Faustina's village doesn't have electricity, like about 800 million others. She doesn't have connectivity on her cell phone, if she's even lucky enough to have a cell phone. And because of climate change and over-farming, she's actually unable to do the practices that she used to be able to do. So how do we help her? Technology. We think that it takes having your head in the clouds, cloud services, platforms, middleware, but it also takes taking your feet on the ground. So our agents on the ground to help learn and educate people there. How do you get from a problem to a solution, though? First, yep, exactly. First it takes, how do you get from a problem to a solution? It's a messy process, obviously, but it takes a financing in order to get from the problem to the solution. Here you've got 3 people that helped us learn about how you can help smallholder farmers in Malawi. And through this, we helped create an idea for a ChatGPT-based client. We call it Oolong Easy. It's a WhatsApp-based AI tool that lets you get great agricultural information that's sourced from the government of Malawi. And through it, you can learn more about the different practices that would work well for you. Please find me later today if you're interested for a demo of this, or if you want to talk about funding innovation. So thank you.
Sorry. Good afternoon. My name is Carrie Schonwald, and I'm the director of Providence Global Programs. Providence is one of the largest Catholic healthcare systems in the U.S., with over 50 hospitals and 1,000 clinics across 7 western states. Since 2012, Providence Global Programs has been partnering with governments and NGOs to make health impact. We do this through sustainable initiatives in education and infrastructure investment. We have been partnering with World Telehealth Initiative, where we increase access to clinical education across low-resource settings. With GMI, we make impact with low-resource college students to prepare them for the job market. And with Buena Semilla in Guatemala, we provide economic support. Since 2017, we have been partnering in Malawi with the Kamuzu University of Health Sciences in infrastructure and education, a program that we co-created with them to increase the physician pipeline in a country that has 1,000 doctors for 20 million people. We support bidirectional family medicine education by sending clinicians in both directions. We've sent over 50 U.S. residents to Malawi to learn and mentor, and we have brought the first 10 family medicine registrars from Malawi to the U.S. to learn and mentor. We have provided 5 point-of-care ultrasound devices and training of trainers, as well as built a medical skills lab for learners to practice their skills. We invest in water, sanitation, and hygiene through our partner Catholic Relief Services across the Mangochi district. So, how do we fund? We ask our partners, how can we make an impact? Then we listen, we collaborate, and we pivot. We follow their lead. If you'd like to hear more about these initiatives or learn how to co-invest, please come and say hello. Thank you so much.
Sharwan was born in northwest Rajasthan. He always remembers his mom being sick when they were little because they couldn't afford her medical care. He decided to become a doctor to help families like his own. This is Dr. Sharwan Sani today, Executive Director of Save Kids Trust India. Founded in 2002, we now have 3 brick-and-mortar clinics, a staff of local people, 20, and we serve over 15,000 people a year. The people we serve are hardworking and extraordinarily resilient, and yet they have little to get through hard times. We share all of their stories on our website and through quarterly newsletters with donors. We start with kids and their moms with medical care. Our street clinics can reach a lot of common ailments, and the tougher cases are referred to our brick and mortar clinics. Nisha brought herself to the clinic when she couldn't shake, feeling awful. She was severely anemic and needed a blood transfusion. She knew to come to our clinics because she had attended an educational seminar that we'd put on. The seminars are central to what we do because the people trust us and they are hungry for helpful information. Our seminars focus on menstruation, maternity topics, mosquito-borne illnesses, and even simple hygiene for the children. But now and then, help is a little bit deeper than a medical care, and we have used skills and talents in numerous families to promote livelihood training. These families tend to be led by widows, and all of them are breaking out of generational poverty. Today, we need your help opening our 4th clinic. It's going to serve an area of Jaipur that reaches the Banjara community, and they're very excited about it. My name is Donna Shively. I'm president of the board here in United States Save Kids Trust, and we have a table out there. Thank you.
Sarah Omega's uncle raped her and got her pregnant when she was 18. Then she had 2 days of agonizing labor where the baby was stuck and died of the trauma, and Sarah nearly died too. Then she had a hole in her birth canal into her bladder. That's an obstetric fistula. Sarah leaked urine continuously until she was 30, when a fistula surgeon found her and repaired her. Now she's a mom, and she's the director of all our Kenya programs. Thousands of ladies have catastrophic birth injuries like Sarah every year. Obstructed labor is one of the top causes of fetal and maternal death. I'm Kathleen Davis, and I'm on the board of the Worldwide Fistula Fund. We develop long-term relationships with fistula surgeons and champions like Sarah. We mentor them to be leaders, and then we support them to develop their own programs in each of their countries. We have trained over 1,200 fistula surgeons, nurses, and physical therapists. As our ladies recover, the local teams train them to have skills that they can turn into businesses and earn income. They also learn how they can teach their communities and beyond how to have safe pregnancies and deliveries. We would like you to partner with us to make every birth safe for every mother and child. Also, if you would like, we can show you how you too can have a way too cool Birkenaba bag for the holidays.
That was so great. I love this fast pitch. Let's give everyone one more round of applause.